Hi, welcome to Pre-Health, What You Need to Know, hosted by Director of Health Careers Advising Stephen Scherger and Dean Nancy Dilulio of the Office of Undergraduate Studies. I'm Lynmarie Hamel, also from the Office of Undergraduate Studies, and I'll be taking your questions via email to be answered live on air. If you have a question, please send it to summerreghelp@case.edu with the subject line Info Session. If we don't answer your question live, we will follow up with you via email shortly. Now, to your hosts, Stephen Scherger and Nancy Dilulio.
Thank you, Lynmarie Hamel, and also thank you for those of us who are joining us this evening, at least this evening Eastern Standard Time, as we are going to do this session, Pre-Health, What You Need to Know. To start off, I'd just like to cover a few goals that we have for this session, just so you have an idea of what we will be covering this evening. First of all, this session should help you understand academic requirements for the pre-health sciences. While it's true that there is no pre-health major or pre-medical major here at Case Western Reserve University, there are many academic requirements that you need to be aware of that you will need to complete as undergraduate students. These are requirements that the medical schools, dental schools, and other pre-health professional schools will be requiring you or expecting you to have completed. Secondly, we want to focus in on helping you to develop your fall 2013 schedule. And finally, we hope to be able to answer your questions about being a pre-health science student at Case Western Reserve, both in terms of academics, but also beyond, and many of the extracurricular activities you also want to include. Just want to reiterate one more time that as we go through the session, as we're speaking here at the beginning, but then also throughout the session when we open more to a question and answer format, that you should send your questions by email to summerreghelp@case.edu. So starting off, we want to look at what are some of the different considerations that you should be thinking about when planning your fall schedule for this upcoming semester, but also thinking about the next 3 years and what classes you want to be taking. And essentially, there's two different things you want to always keep in mind. First of all, you want to be thinking about your program requirements. And what I mean by that is, what are the requirements that the med schools have, that the dental schools, the other health professional science schools will have and expect for you to have completed. Now, in general, we do know what most of these requirements are going to be, requirements out of chemistry, biology, physics, and so on. However, there are unique requirements to each of these programs as well. For example, if you're a physical therapy, thinking about physical therapy as a career, you do not need to worry about taking organic chemistry or biochemistry. However, you will be expected to pick up most likely a course in developmental psychology, where most of the other health sciences would not need that. Likewise, if you were thinking pharmacy as a career, you will have to do 2 semesters of calculus, and some of the programs require an introductory course in economics, which is unique as a health professional science. The other thing you also will need to know as you go through your career at Case Western are unique requirements to individual programs. So for example, there may be a medical school that requires anatomy in order to be able to be accepted there. Most of the programs do not require that, but some do. So you need to be aware of those programs. The other thing that you need to be considering when thinking about your schedule and what classes and requirements you're going to need to meet are the admission exams to each of these programs. So for example, with medical school, you have the MCAT. With dental school, it's the DAT. Pharmacy schools have the PCAT. Optometry has the OAT. And for vet med and physical therapy, it is the GRE that you're required to take. These different tests are going to be testing different areas of the sciences. They're going to be testing your proficiency, your ability to use these sciences. And so we also need to be anticipating when you'll be taking this and what classes you need to complete before you take them. Typically, these tests are taken by students at the end of their 3rd year, and so you want to try to have these requirements completed by that time. Especially for the medical students, the pre-med students, you need to be aware that there are changes coming to the MCAT, the Medical College Admissions Test, in 2015. What that means is you are the first class that will be impacted broadly by these changes, because it will be in spring of 2015 when most of you will be taking that exam. Some of these changes are what will be going away from the old test is you will no longer have a writing section. So if you're not a great writer, that's good news for you. But what will be replacing it is a new section on social and behavior sciences. So there will be an expectation that you've had some introductory psychology and perhaps sociology as well. Likewise, biochemistry, cellular molecular biology, and statistics are going to be seen as either new subjects or subjects that receive additional emphasis on this test. So when we look at the classes that you need to take as an undergraduate student, and the recommendations we're making, these are what we have in mind in doing so. I will now turn it over to my colleague Nancy here, who will go through some of the health science requirements.
Thanks, Stephen. So as we're thinking ahead to the courses you're going to need to take, as Stephen already mentioned, you have to consider the requirements for the particular health sciences program that you plan to matriculate to following your time at Case. When we think about that, what we see in common, what almost everyone's going to require, are going to be 2 semesters of inorganic chemistry with a lab, 2 semesters of organic chemistry with a lab, 2 semesters of biology with a lab. But I want to make note here that the biology department here at Case actually approaches the introductory biology sequence a little differently than some schools, and they have a 3-semester sequence of biology courses. So we're going to recommend that you take all 3 of those semesters so that all of the topics that you need to be well prepared for the health science program that you want to matriculate to are going to have been covered, and all the topics that you're going to need for your entrance exam are going to have been covered. Now, of course, you're not taking all of these your first year, but let's go through the rest of the requirements. In addition, there are 2 semesters of physics with lab. You're going to need a semester of biochemistry. You're going to need 2 semesters of English composition. The 2 semesters of English composition are also a little bit unique to Case in that all of you, as you enter the university in this first semester, are going to take something called your first seminar as part of the SAGES program. The first seminar that you enroll in as part of our SAGES program has lots of opportunities for you to write papers, give presentations, participate in class discussions, and so on. So it's really about building those critically important communication skills that you're going to need in your health profession. And that first seminar course counts as one of those semesters of English composition. You're going to follow up that first seminar course with a university seminar course, which has a similar format to lots of discussions, lots of paper writing, presentations, and so on. Those 2 courses will make up your English composition requirement. And finally, 1 to 2 semesters of calculus are recommended, and a semester of statistics. So this mathematical training and those requirements vary from school to school, but this general guideline, if you take this set of courses, you're going to be covered for pretty much all the prerequisites for whichever path you decide to choose. Now, as we're moving on a little bit and thinking about degree programs, you might want to sort of look at that list and say, wow, what am I going to major in if I'm doing all of those things? Well, it turns out that your degree program, your major area of interest, doesn't have to be in biology, the biological sciences, chemistry or biochemistry, or physics or math, all of those things that we just listed previously. Your major area of interest should be a topic that interests you. So you can major in whatever topic you like and still be prepared to matriculate to a professional school in a medical profession. It's important that you do well academically as an undergrad, as you're showing those professional school programs that you're able to be successful in a very challenging curriculum. And part of being successful is choosing things to do that you're interested in and that you enjoy. So you really want to pick the major that you're most interested in. There is no major that is the best major to being a student who wants to go to medical school or dental school or pharmacy school and so on. In addition, we have lots of students who come to the university planning to do multiple majors and minors. And while you certainly can do that, and our curriculum is relatively flexible, you don't have to. More is not necessarily better. Having 3 majors and 2 minors isn't the key to moving on to a successful professional school. But if you're really interested in those topics, that's fine, but a single major with a minor or a single major without a minor is also all that you really need to move on to these pre-professional programs. We have the option in many of our departments to take your major as a Bachelor of Arts degree or a Bachelor of Science degree. Once again, there's no right or wrong answer here. Most of our students who matriculate into professional programs out of the sciences and social science majors are earning a BA degree. Our engineering school has a BSE, a Bachelor of Science in Engineering, and so that's another path that you can take into the professional programs. And finally, all students at the university have to meet certain general education requirements. A part of that are our SAGES general education requirements and those SAGES courses that I already mentioned. But in addition, you need to do something called breadth requirements, where you're going to be taking courses that come out of several different departments. This is a chance for you to explore some other interests, some things that, you know, maybe you didn't know anything about, so you want to take a course and try it out. This is also a great place, if you do decide to major in the sciences or engineering, to take those social science courses that Stephen has already mentioned. Something in sociology and psychology and medical anthropology. Those types of courses are going to give you skills and understanding that's going to help you as you prepare for those pre-professional programs.
Some other schedule considerations that you need to think about, especially as you think about what classes you'll be taking this first semester in the fall. Many of you we know will be coming in with either AP or IB credit, and you may have heard that some medical schools, also some of the other health professional schools, do not always take the AP credit. They don't accept that as meeting their requirement. And unfortunately, there's no easy or definitive answer to when will this occur, when will this not, because each individual school has their own policies that they adhere to on this. In general, though, we do know that if you have AP or IP credit that you would be bringing to the university, if it's in the non-science area, it's perfectly okay. Most of these schools will not have non-science requirements beyond writing composition, which will be covered by SAGES here anyway, as well as they may have a requirement in the social behavior sciences, but typically they're okay with taking AP credit in those areas. Likewise, if you have AP credit either for calculus or physics, most of the schools are okay with accepting that as meeting their requirements as well. Where the schools become a little more particular and they are not always as willing to accept the credit is in biology and chemistry. Now with biology, that won't be a concern for you, because even if you received a 5 on the AP biology exam and you do receive credit here for it, it's not going to be credit that covers the requirements you need to the course or the courses that we teach that meet the requirements for medical school. And so although that credit you may be able to use it to apply towards your degree requirements here or just towards your hours towards graduation, you still would need to take the sequence of biology courses that we offer here to meet that requirement. Where it becomes a little more tricky is on the chemistry side. And this is because if you did receive a 4 or 5 on the AP chemistry exam, you will receive credit for a full year of inorganic chemistry with lab, chemistry 105, 106, and 113. Now, it will be your choice whether or not you want to accept that credit or not, and that should be based really on 2 factors. First of all, you should be asking yourself, are you ready to actually move on to organic chemistry? Now, some considerations you will want to think when thinking about how you're going to answer that question is, how long has it been since you had your high school chemistry? If you had it in your senior year, there's a good chance you are ready because you haven't had much of a gap in the material, a gap in time that is, in covering the material. You would be ready to move on to organic chemistry. However, if you took it in your junior year, especially your sophomore year, you may need some review before you're ready for organic chemistry. To really be able to answer this question, you may also need to consult with Dr. Michael Kenny, who is the department representative for chemistry, and he could better advise you on that question. He will be holding sessions later, I believe, in the following 2 weeks, where he'll be able to address questions like that. One option also is if you feel you need a little bit of review for your general chemistry, but maybe not the full year of it, is you can keep your AP credit for the first semester, Chem 105, and then in the spring move on to Chem 106 and pick up your general chemistry there, and then move on to organic chemistry in your second year, when most students do take it. The other consideration, though, in whether you want to accept or not your general chemistry is, again, thinking about, will the med schools accept your AP credit as meeting their requirement? If you do decide to move on to organic chemistry, what you would need to do is either in your second or third year, pick up some additional coursework in biochemistry to make up for that missing as one of your college courses. Most medical schools are more than glad to accept biochemistry as a replacement for the general general chemistry requirement. Other concerns beyond AP that you also need to consider is how many hours you would be taking in the first semester. Generally, you want to be looking at a schedule of 15 to 17 credit hours. Now, depending which courses you take, that could range anywhere, typically between 4 or 5 courses. And in a minute here, we will be looking at some sample courses or some recommended course schedules that will give you an idea of what that will look like in more detail. Finally, and kind of related to what Nancy already spoke about in terms of your general education requirements, always keep in mind that you may also have room for electives in your curriculum, and there may be other courses that are offered at the university that, I mean, in the sciences, but also especially in the social sciences, but even in the humanities, where they relate to topics maybe not directly of medicine or the science related to it, but issues related to healthcare policy, the economics of healthcare in the United States, also maybe comparative studies looking at other healthcare systems in the world that you would then compare to the United States. While most medical schools don't require specific courses in such areas, it can always be a benefit to making you just a more well-rounded student and a better applicant to be informed in these areas. Certainly when it comes time to interview for those schools, it'll help you at that time as well. Now, finally, what we want to do here is we are going to give you some sample curriculums of, depending on what your major is, what it would look like over the 3 years in terms of meeting all of these requirements that you need to for medical school, dental school, and other health professional schools. So first here we have on the screen is the biological and chemical science majors. And we're going to go through these pretty quickly. It's a lot of information. So if you don't get it all, don't worry, because you will find this information on the FYI guide, the first year information guide that you can access online through your checklist on page 36. But if you look at the screen right now and you look at that, especially at that first semester, you'll see that there's an expectation, if you're thinking of majoring in the biological and chemical sciences, of doing calculus, chemistry, and biology. And if we look more broadly across the 3 years, what you'll see is a plan. As we look at some of we're going to show you 4 different plans depending on your major. What you're going to consistently see is that in your first year, regardless of your major, you need to get your general chemistry in. In the second year, you need to cover your organic chemistry, and in the third year, really in that first semester, you want to take biochemistry. You're going to need to take all of these because these are all sequential, and you want to have all of them completed, again, before you take that MCAT, that DAT, or whatever the admissions test is going to be for those professional school programs. You're going to want to have them completed before your spring semester. Most students, again, take these tests at the end of their spring semester, typically between March and June. For the biological and chemical science majors, again, you see that you're taking care of your biology requirement in your first and second year, and then you're picking up physics in your third year. In addition, you'll see on the right-hand column there under other coursework, you do need to take a 1 semester of chemistry lab, Chem 113, and that can be taken either in the first or the second semester. You do have a choice for that. Also, as has already been mentioned, for your SAGES requirements, the courses you'll be taking for SAGES, that will cover any English composition requirements that these professional schools have. At some point in your 3 years, you do want to take an introductory sociology or psychology course, and then you're going to need to talk with your major advisor whether a statistics course is a good idea for you or not. For some students in the sciences, depending on what you're doing, the BA, whether you're doing the BA or the BS, or specifically what major you're taking, you're all going to have the statistics covered, whether it be through a specific course or spread throughout the curriculum. Other majors, though, it may be determined that you really do need a separate statistics course for that. Now, going to the next slide, looking at students who are thinking of majoring in the mathematical and physical science majors, this looks very similar to the first one. Really, the only significant change is that we've moved physics into the first year, and we're moving biology back to the second and third years to be completed. If you're thinking about an engineering major, very similarly, we have physics in the first year. Now, depending on which engineering major you go into, your major may want you to start physics in your first semester. They may want you to wait until your second semester to take it. Even though this chart has physics in the starting it in the first semester, if your major recommends it in the second semester, it is okay to wait till the second semester to start it. The engineering majors typically then complete their biology requirement in their second and third year. The other thing to note here is in the first year of general chemistry, instead of doing Chem 105 and 106, you have engineering chemistry courses that you want to complete. Chem 111 in the first semester, and then Engineering 145, a material science course that you would take in the second semester. Med schools, dental schools, and so on will accept that material science course, Engineering 145, as a second semester of general inorganic chemistry. However, also note, you still need to take the Chem 113 lab at some time during your first semester or first year. Finally, for those students who are thinking of majoring in the arts, humanities, or social sciences, here again you see very similar that the biology is moved back up into the first and second year. Physics is moved back to the third year. One thing that we do recommend is that you actually do take your Chem 113 lab in the first semester. And the reason we recommend that is because we want you to have the opportunity to take a course in your major, or at least related to your major or your area of study that you're thinking about, while still getting in all of your other requirements. Now, once you add your biology course with lab, your general chemistry course, the lecture, and then remember you have to take a SAGES course in your first semester. At that point, if we're going to add a course from your major, let's say you're interested in majoring in psychology or history and you want a class in that major, we're now up into that 15 to 17 hour range. So there's really only room to take Chem 113 at this time, rather than taking Math 125 or your calculus course at this time, which is, if you look at the chart, you can see that it has been moved to the second semester here. So, and again, I know we went through these pretty quickly, and you probably want to look at these in more detail. You can do so during the session or after today's session by referring to the FYI guide, page 36. And at this point then, I think we want to open it up for any questions that may have come through at this time.
So,
okay, so you guys talked a lot about the majors in different schools. So we have students who want to know, do medical schools give preferences to certain majors?
No, they do not. And we hear this directly from the admission committees from the medical schools, that there is no preference for one major over another. There isn't a preference for a Bachelor of Arts over a Bachelor of Science. There is not a preference for a major in the sciences versus a major in the non-sciences or a major in engineering. The medical schools, the dental schools, and so on, what they're really interested in is the quality of your undergraduate experience and how did you challenge yourself in the major that you chose. And so, yes, they don't want to see a student who's simply done the minimum requirements, and they want to see students who have done upper level work, maybe independent studies, maybe gotten involved in research. But regardless of what your major is, they're going to be looking for all of those things.
Great. So do medical schools mind if I transfer in AP psychology credits, since it's considered a science course?
From what we've seen so far, and historically, the answer would be that they are okay with accepting AP psychology. Again, most medical schools don't actually have a requirement right now for the social or behavior science areas. I will say, however, though, that things are changing. As the MCAT changes in 2015, we expect the med schools to also change their requirements, and we may begin to see more schools require a psychology or a sociology course. And so it is kind of hard to predict what is going to occur. That being said, I feel pretty confident that most of them will be accepting of the AP credit. However, I would also suggest if you're bringing in AP credit for a Psych 101 or a Soc 101, what I'd recommend is that if you still have other general education requirements to complete, so let's say you're a biology major, you have to do 2 social sciences. And so if you've knocked one out with AP, think about taking a Soc course, or think about taking an upper level psychology course. We have a lot of courses that actually focus on health topics. And so that's the route I would recommend.
Great. We have some more questions regarding AP courses, so we'll kind of continue with this theme. So Rick would want to know, if we have AP chemistry score of 5, are we allowed to move into organic chemistry, the classes and the labs in the first year?
That's a great question. You can move into the organic chemistry class in the first year. The organic chemistry lab, you may have to defer until your second year. But one of the things to consider is if you have that AP score of 5 and you're going to move into OChem, really think about, did you take that course your senior year or did you take that course your junior year in high school? If it's been your senior year, you should be pretty ready to go. If it was your junior year, you might want to delay that OChem and get used to the university environment, the style of learning in your university courses. Take Chem 106 in the spring and then move into OChem in your second year.
Okay, so moving away from some of the actual course requirements, is it required that students do research as an undergraduate student to get into medical school?
Oh, great question. It's not actually required, but doing research is a great place to develop some skills that you can take with you to medical school. So for example, when you're working on a research project, be it in the social sciences, the biological sciences, the biomedical sciences, the physical sciences, whatever area it's in, one of the things you're going to be challenged with is taking in a lot of information, deciding what's really important about that information, posing some questions and hypotheses, and deciding what data you need to test those questions and hypotheses. And those are skills that are directly transferable into various healthcare practice, be it medicine or dentistry, and so on. So thinking through the research process is going to be really helpful for you. It's not a requirement, but it's a great skill building opportunity.
Great. So students realize now they may need to do some research. They want to know, how do they get involved in research as an undergraduate student?
There's a lot of different ways that you can find research opportunities at the university. Oftentimes I meet and hear of students who simply, through casual conversations with their faculty members, with professors that they have in classes, with the department representatives who work with the majors, that they find these opportunities in them. Some students will just go on the department websites and they will see, well, who's doing research in what lab, what topics are being covered, and they'll see that, oh, I see that this professor is doing research on Alzheimer's, and so they'll just email the professor and see if they have an opening in their lab. If you are having a little difficulty finding research, or you're having difficulty making those connections, there is also the SOURCE office, which is the support of undergraduate research and creative endeavors. And this office will also help you, Dr. Sheila Pedigo, who runs that office, will help you find those research opportunities as well. She will help you make those connections, find the right people to talk to so that you can find those opportunities. One thing I will say is I've never met a student, if they tried and they were proactive in looking for research, not be able to find it here.
You know, I think one thing I would add to that question or that answer is that sometimes you're going to have to start out as a volunteer in a lab. So you might not go in with a paid position or a position where you're earning course credit, but if you offer to volunteer in a research lab and show yourself to be a reliable, hardworking member of the lab, you're going to get the opportunity to move up and get your own project.
And one other thing I guess I would also add in terms of research is don't think you have to limit yourself to the undergraduate faculty either. We have a lot of students who are doing research at the medical school, also down the street at the Cleveland Clinic, as well as other health and biomedical locations and hospitals in the area.
Okay, so Sabrina has heard that medical schools dislike when students use AP Science credit. Is this true, even if a higher level of science is taken?
Typically what we've seen from the medical schools is that if you do a higher level of science to replace the AP credit that you used, that will be sufficient. And so, for example, again, using the example of chemistry where we see it most commonly occur at CASE, is if the student goes on, and especially if they take some upper level coursework in biochemistry, the medical schools are absolutely okay with taking that as a replacement. Now, I have had one dean of admissions from a med school say, unless the student was a chemistry major, you don't necessarily have to continue in chemistry beyond OChem. So usually the next step after that would be physical chemistry. And as she said, you don't need physical chemistry for med school. We don't have a high interest in whether you have a good grasp of physical chemistry or not, so you'd want to go the biochemistry route instead.
Okay, so we have a question from Adithi. She wants to know, if I have already taken calculus over the summer at a college and want to transfer it, what course will I substitute that with during my first year?
So the answer to that question depends a little bit on what major you choose. So I'll start with an engineering option. If you're choosing to go into an engineering option and you've completed Calc 1 this summer, you're going to move on to Calc 2 this fall, because Calc 2 is offered every semester, as is Calc 1, so you'll just continue right on that particular path. If you're moving into the biological or chemical or physical sciences, once again, this fall semester, you can move right on into Calc 2. If you're thinking about an arts and humanities course, you may not need to move on into Calc 2. You may think about doing a statistics course this fall semester.
Okay, so we have another question. We talked a little bit about research, and now students want to know, do faculty members accept freshmen as members of their research team?
They do. I've worked with many of my faculty colleagues who will take a freshman into their research lab. But once again, you have to remember that you're coming into an environment where maybe some specialized skills are needed. So you might have to start out in the lab as a volunteer and kind of work your way up. So be open-minded. Try it, talk to some faculty, approach them. And when you talk to faculty, you really want to pick out faculty members that are doing research that you're interested in. So if you've read a little bit about the work that they've been doing, and send them an email and say, hey, I'm really interested in that work, they're always flattered by that email, and they'll chat with you. So many first years get into research labs.
Okay, we have a question about the Case Med School. Does a Case Medical School or dental school give preferences to Case undergraduate students?
No, neither the medical school or dental school gives preference in their final admission decisions to Case undergraduate students. It really is a neutral factor for them. Now, that being said, you will see that many, like for the medical school, if you looked at what undergraduate institution does the largest minority or the largest plurality of students come from, it is Case undergraduate, but that's just because most students, after they spent 4 years, often want to stay here, and they end up applying to Case Western Reserve anyway. So it's just the largest pool of applicants that they're drawing from. But again, in that final admission decision, it is really a neutral factor.
I guess we have some athletes watching tonight. So we have a student who's thinking of playing a varsity sport, but they're worried that the time commitment might impact their GPA. Do you recommend that they play a sport or not?
I would recommend that they at least give it a try. And the reason I say that is medical schools, and even some of the admission people that I speak with at the medical schools, they've told me directly they really like varsity athletes who are able to be successful both on the court or the field and in the classroom. And the reason being is for you to be able to manage the time commitment and the multiple responsibilities of your commitment to your athletic team as well as to the classroom, that's a good indication you have the time management skills to be successful in medical school or in a dental school or similar type programs. Now, that being said, some students do find it a bit to be a bit too demanding on them, and they may see that their GPA begins to slip, or they may feel that they can't get in other activities that they want to as well. So sometimes a student does make the wise decision after maybe playing their sport for a year or two that they do need to withdraw from it just so they can use that time to commit to other areas. But again, I would recommend, if you really love your sport, if you really want to keep that aspect of your life with you, at least for the next 4 years, at least give it a try.
Okay, Rick would like to know, are we recommended to take both Psych 101 or Soc 101, or one of them, one or both, I guess?
Mm-hmm.
That's a really good question. And in fact, I think both of them are really good. They both approach the topic very differently, so you'll learn different skills. But as you're looking toward prepping for the MCAT in the future, I think taking both of them will be helpful, but really you only need one. But remember, everyone's going to need to take 2 social sciences at some point, no matter what your major. And Psych 101 and Sociology 101 aren't your only choices. There's some great courses in anthropology and medical anthropology and other topics that you might want to explore that are going to give you some of those same types of skills.
Okay, we have a biology major who asks, if I get exempted out of Math 121, 122 from AP scores, would I need to take additional math classes?
Not to meet the requirements of your biology major. You would be all set as long as you're doing the biology BA, and that also should cover you for what you need to do in terms of the prerequisites for your healthcare professional school as well.
Okay, Akansha wants to know, if I'm planning on doing an economics major, do you recommend doing physics or biology or chemistry in the first year?
Well, in the first year, you certainly want to do your chemistry. Like I said earlier, that's probably, your chemistry is the most sequential part of the courses that you need to complete. And so it is essential that regardless of what major you are, whether you're econ or some other major, that you get your chemistry in your first year. Then you really probably want to take biology as the other science course that you would do in your first year as well. Most students go that route, and they typically wait until your third year to do to pick up their physics. I guess if you wanted to switch the two around, it wouldn't necessarily be a problem, but I would recommend getting the biology out of the way or at least start to get it out of the way in the first year.
Great. So now we have a few students who want to know if there are test prep courses offered at CASE, and if so, when should they be taken?
Yeah, so currently, at least a course offered by the university is not something that exists. I am doing some exploration right now. We're talking with some colleagues at some other schools about what that might look like, and is this something we want to explore and actually implement at CASE? But there's no guarantee that that is the route we're going to go. That being said, for those students who feel they need the test prep courses, and I don't believe every student does, but for those who feel that they do need it, there are certainly plenty of opportunities, whether you want to go through Kaplan or Princeton Review or Exam Crackers or one of the other test services to take their courses, whether they be, I know, for example, Kaplan teaches their courses on campus. The other test services have facilities, if they don't teach it on campus, that are very close to the campus area, so they are able to do that. I want to go back though to saying though it's not necessary that every student takes those courses. If you're a strong standardized test taker, if you've been diligent in your note taking throughout all your science courses and you've kept them organized, and you have the self-discipline to really put in the time necessary months in advance to prepare for those courses, you may find that you don't need an actual course. I would, though, regardless, recommend that you do get some of the test prep materials out there, whether it be the ones that are published by the MCAT itself or the DAT and other test services, or going through one of the private testing agencies.
Yeah, and if I could just add one quick point to that, remember that all of the coursework that we've outlined for you today, right starting from your first year, those courses are your test prep. You're getting ready for those entrance exams as you take those courses. And regarding the timing, if you do decide to take a test prep course, you want to look at when you're going to take your entrance exam. So typically students are going to take it at the end of their junior year semester, spring semester, so early May of that year, say. So you would really be doing your major test prep during that junior year spring semester.
Great. Now we have a student who is planning on being a social science major and wants to know, will they be at a disadvantage compared to a biology major, since they more or less have covered what will be further covered in medical school?
You would not be disadvantaged in two ways. One, as we've already stated, there would be no disadvantage in terms of your application to the medical schools. Again, the medical school admission committees do not automatically give preference to science majors over non-science majors, so you don't need to worry about that. Secondly, in terms of being ready for medical school, the general requirements or the core requirements or prerequisites that the school set, that really should just be the minimum that you need to know to be prepared in order to do well in medical school, or again, in dental school or these other health science professions. Now, that being said, typically students who do major in the social sciences find that they have a lot of electives that they can take, and so I will often recommend that maybe they pick up an extra biochem course or perhaps an anatomy or physiology course course. Not necessarily, again, because they need it to be successful, but they just are going to be better prepared, and they may find that first year of medical school a little more tolerable with that background in their pocket.
Great. So now we have a student who's interested in earning an MD, PhD, and wants to know if there are any different requirements for these programs.
Typically, in terms of the courses that you need to complete, there aren't different requirements. I do know of one exception to that, and that's actually with the CASE MSTP program, that if you're admitted into that program, they do require the second semester of calculus, where the regular MD track does not. They only require one semester of calculus. But for the most part, the courses that you need to complete are the same. What is different is the expectation of having research in your background. Before, when we were talking about research, we said, well, no med school really requires it. It's a good idea to have. For these MD, PhD programs, and I've heard this directly from the admission directors, they want to see a minimum of 2 years bench research experience. And so it would be important, if not in your first semester, probably in your second semester, to find a lab that you would begin working in.
Okay, now we have another question. I apologize, I'm telling students' names on here if I'm totally not getting them right, so I'm apologizing for everyone in advance. But Akansha wants to know, if I take my first year a little easy to get used to CASE's academics, is it okay to push back the chemistry, math, or biology into the second year, or take it in the summer?
Yeah, that's a really great question. As Stephen has mentioned, really the most sequential of the courses that you need to prepare so that you can apply to your professional school between your junior and senior year is really the chemistry. So if there's a course that you're going to push off from your first semester and your first year, I would not recommend it be the general chemistry. I would get that in for sure. And now if you want to use your summers to do some coursework, that is another possibility. So if you take it a little easy your first semester to add in those summer courses. But when we look at the recommended schedule for that first semester, if you're thinking about a chemistry course, a math course, a biology course, and a first seminar, that's a pretty typical load for a student who's planning a professional health career. And one of the things you want to show the medical schools is that you can be successful in that type of curriculum.
Great. Now we have a student, Sadvika, is planning on majoring in biomedical engineering and would like to know how common is it for students to get a minor along with this major, and does this look competitive for medical school?
Looking at the prior biomedical engineering students, especially the ones who have majored, or not majored, but who are planning to go to the med school route and have done a pre-med. I can't say that they're more likely to do a minor than other BME majors or even other engineering majors in general. I think it really does come down to just your own interests, and do you have an interest in some other subject outside of engineering? So let's say you wanted to continue your proficiency in a language, or you wanted to pick up a new language, or perhaps you, from high school, you took a course, maybe an AP course in economics, and you want to continue in that. Then by all means, you should certainly think about doing that and explore those academic interests, especially because this may be the last time in your academic career before you go on to medical school that you're going to have the opportunity to take those courses. That being said, I wouldn't necessarily look to pick up a minor just because you think it's going to strengthen your application or strengthen your chance of getting into one of these professional schools. Here again, it's not the accumulation of majors and minors that the schools are looking at, or that they're interested in. They're really looking at the quality of the experience and where did you challenge yourself. And so if they see that, again, you had an interest in learning Italian and you did 4 semesters or a minor in Italian, they're going to look at that favorably. Not again because you have that title on your transcript saying you have the minor, but that you went and you explored and developed as an individual.
Okay, so we talked a little bit about research experience. We have a few students who are interested in knowing if there are any student organizations at CASE for pre-med, pre-health students to get involved in, and do they have to join these organizations?
Yes, there are a number of organizations that students could join. For the medical students, there is AMSA, the American Medical Student Association. We have a chapter of that here on campus. There's also Phi Delta Epsilon, which is the international co-fraternity for pre-med students, as well as we have our own Daniel Hale Williams Pre-Medical Society as well. So there are 3 different organizations that are specifically focused just for pre-med students. We also have a pre-dental club that's very active on campus and in the local community. Just brand new, started up last year, as we now have a pre-veterinary medicine club as well as a pre-pharmacy club. And so there are a lot of opportunities for students to find where they can interact with other students who have similar interests. That being said, there is no expectation by the professional schools that you join one of these organizations, and many students end up joining other types of organizations, whether it's getting involved in student government on campus, it's joining a fraternity or sorority, a special cause, getting involved in community service. And really what the medical schools just want to see is that you were an engaged person in your community, that you were actively involved, that you took leadership roles among your peers while an undergraduate student.
Okay, great. Mindy would like to know, can you take physics earlier than the 3rd year, since it also includes material that will be covered on the MCATs?
You can certainly take physics earlier than your 3rd year. The recommended timing we've put together is to make sure that you finish physics prior to taking those entrance exams at the end of your junior year. Moving physics into your 2nd year or moving physics into your 1st year really depends on the course load that you want to take on. And if you have some AP credit for that general chemistry and you're going to do organic chemistry in your 1st year, then it might make sense to move physics into your 2nd year. We've tried to space those core courses out, allowing you to build in around those courses other things that you need to take for whatever major that you are pursuing in terms of your degree.
Okay, so going back to some research, does the research have to be in the biomedical sciences, or is social science research okay?
Social science research is definitely okay. Whatever research area you choose, you're going to be really building a set of analytical skills and tools for yourself that are going to be directly transferable to working in the healthcare setting. We have many students who do research in the psychological sciences, the communication sciences, and cognitive science. We have students who do research projects across the board. Some of our students will do research at institutions outside of Case Western, other institutions we have here at the university. As long as you're in a position where you're analyzing information, proposing hypotheses and questions, collecting data and evaluating the validity of that data and making conclusions, you're developing the skill set that you need.
Now we're getting some questions in about volunteer experience. How do students find volunteer experience and/or shadowing experience when they come to campus?
Great question, especially because after a strong MCAT and a strong GPA, I would argue that your clinical exposure is going to be the next most important thing in terms of building a good application and becoming a competitive applicant or candidate to these schools. The great thing about being here at Case Western Reserve and being part of the university community, the University Circle community, is that there is a plethora of opportunities for you to find these volunteer experiences as well as shadowing experiences. Of course, we have university hospitals right here on campus that are tied to the Case Medical School. In a very short walking distance, we're down at the Cleveland Clinic, rated the 4th best hospital in the United States. There's several other hospitals and health clinic facilities that are within walking distance, including the Free Clinic of Greater Cleveland, which is just north of campus. Especially the hospitals like UH and the Cleveland Clinic, they have volunteer service offices that you apply to, and you then get placed by those offices. And as long as they're placing you in a position where you either get some good patient interaction, even if it's something like just checking patients in and helping take their medical history, that's valuable experience. If you get it placed into the gift shop, you may want to pass on that and say, yeah, I'd like some other type of experience, because you really want that patient interaction. In terms of shadowing, we have no formal matching system at the university right now, but I've never seen students have a problem finding a doctor to shadow. Just got to be a little proactive, knock on doors, send emails out to departments, to different doctors, use the networks that you build through your faculty, through other students that you meet. you'll be able to find these opportunities at these health facilities. Also, don't think you have to limit yourself to these opportunities while you're here taking classes. During the summers, whether if you go back home, look at your hospitals and your health clinics in those areas as well. Talk to your own doctors and see if they'll allow you to shadow. Also, don't think it has to be just a hospital or a health clinic. Hospice centers, nursing homes, patient recovery houses, these are all great experiences to get that clinical exposure.
Just to follow up on that, students want to know, are there a certain number of hours that they need to do for volunteering or shadowing, and just what's the extent of their involvement that they need with these activities?
Right. On the medical school side, typically the medical schools don't put like a minimum hours that they're expecting, so there really isn't a magical number to give. What is more important too is really the quality of your experience and your ability to reflect upon what you saw, what you observed, what you did, and to think about, well, how does that inform your opinion of healthcare? What's quality healthcare? How does it inform your opinion on what type of doctor you want to be going forward in the future? And it's your ability to reflect upon those experiences that are really going to be meaningful when you write your personal statement, when you apply, when you answer essay questions, when you go for your interviews. And so certainly you need enough hours to be able to reflect and think about your experiences and talk about them. And so one piece of advice that I often give students is when you go into these experiences, journal while you're doing it. Take time to reflect, because when it comes time to apply 2-3 years from the experience, it may be kind of hard to think, well, what did I really learn from that experience? You can go back to your journal and you may find that you have your personal statement right there already written in the journal, just needs to be cleaned up.
Okay, we have a few students now want to know, how difficult is it to manage classes for someone who is a biology major and a pre-med student? It seems like it would be hard to meet all the requirements for both of these things in those 8 semesters.
Yeah, that's a great question. And actually being a biology major and a pre-med student really is quite a manageable and quite a common pathway to medical school. The requirements for the biology major, especially in those first 3 years as we've laid them out for you in those course grids, really overlays exactly on what you need to do for a major in biology. And when you think about a major in biology, once you complete those 3 courses, Bio 214, Bio 215, and Bio 216, you're going to follow that up with additional work in the biology department. But the biology department also requires you to take physics and chemistry and math, the same physics and chemistry and math courses you need as you're preparing to apply to medical school. So that is a combination that works well.
Okay, we have a question regarding labs and how they fit in with their courses. So, for example, if someone takes OChem in their first semester, but they can't get into their OChem labs until second year, is that okay? And same things with some of the biology courses that have labs attached to them. Do you need to take the courses at the same time, or can you take them in different semesters?
Great question. You can actually take those labs in the same semester as the course. So Organic Chemistry 1 lab could go with Organic Chemistry 1, the lecture course. But taking the Organic Chemistry lab the next year, the following fall, is not disadvantageous in any way. The lab courses are standalone courses with their own grading rubric, their own system. You earn a letter grade for those courses that is separate from the grade that you learn for the organic chemistry course itself. And the same is true of the bio courses. If you take Biology 214, the first of the 3 courses you need for the biology sequence, if you take that this fall, but you take the Bio 214 lab next spring or next fall, you won't be disadvantaged in any way. So together or separately, it works both ways.
Great. Now we have, going back to some AP credits, we've got a couple of people asking questions. If they have a 5 score in AP calculus, does that meet the math requirements for the biology BA? And it looks like it's for the AB exam, which would be Math 121.
So that actually meets half of the math requirement for the bio major. So that gives you the Math 121 credit, but you would need to take Calc 2. That's Calc 1 that you would have credit for. You would need to take the Calculus 2 course.
Can you talk a little bit more about other courses outside of program prerequisites that students should take as a pre-health student?
Yeah, so some of the courses that I would recommend often is looking at kind of the social sciences. We have a very strong program in medical anthropology here, and it's a very popular program, whether it's a second major or a minor that students pick, or if they just take a couple courses in medical anthropology. Again, both psychology and sociology offer courses that relate specifically to health as well. There's a health communication science major, or a minor, I'm sorry, that students could look at. In economics, I know there's a course on kind of the economics of healthcare in the United States. Same way with political science, there's one on the policy creation and politics of healthcare in the United States. So there are a lot of these different opportunities. Students might also want to think about courses out of nutrition, and also just look throughout the other areas of the biological sciences as well. Again, very popular. What I see a lot of students look at, if they have room in their electives and they're not a biology major, is they look at like the anatomy physiology courses, an upper level course in genetics, microbiology, cellular, molecular biology. All of these would be good courses to take a look at.
I think the other courses that you might look into are, we have some bioethics courses, and we have some ethics courses out of our philosophy department. And certainly as a healthcare professional, those bioethics questions and those ethics type courses are going to give you some good skills as well.
We have a student who'd like to study abroad for a semester or maybe a year. How does that play into their progression with their pre-medical requirements?
Very good question, and it does require to do some planning. I would encourage anyone who is thinking about study abroad in your first year to both come and speak with me about the implications when applying to med school, but also to get over to the study abroad office and begin to explore your options there as well. The thing you've got to really be careful about is medical schools or American medical schools do not accept international credit, and so if you take courses abroad and the courses end up on an international transcript, those are not going to transfer back they may transfer back to CASE for your undergraduate degree, but the medical schools may not acknowledge them. Now, if you do go through an exchange program where those credits end up on an American transcript, whether it be the CASE transcript with the grades, or if it be with another partner university that we work with, then those would be accepted. The most basic general rule, though, is never take any of your science core requirements abroad. You really want to do them at an American institution.
Okay, we're just about out of time, so I think we're at our last question. And students want to know how they would go meet and when they should start meeting with the pre-health advisor.
Absolutely, and actually that kind of is a nice final question, because it segues into some final comments I did want to make. First of all, when you come to campus during the orientation and welcome days, the week before classes start, there will be some sessions that I encourage all of you to attend that I will be running to kind of talk about some of the same topics we've talked about tonight, but also just to kind of introduce ourselves to each other and answer any concerns that may rise between when you schedule and when you do show up on campus. So when you do come during that welcome orientation week, you will want to look at the schedule and see when those sessions will be offered. There will be one session specifically just for the pre-med students, and there will be another session for the other health science students, dentistry, optometry, veterinary medicine, and so on. Also, I do encourage students that, whether it be in the first semester, probably is a good idea, but at least once during the first year, to come in and make an appointment, just so we can meet one-on-one. And then to begin a regular practice, if not once a semester, at least once a year, that we continue to meet one-on-one. The reality is most of you will be asking for a letter of recommendation from me in 3 years from now, when it's time for you to apply to your medical school or dental school. And while I certainly will write a supportive letter for every CASE student that does ask for one, and I will write the best letter that I can for you, it's much easier for me, and I do write better letters for simply the students I know better. And so it is important that we do develop a relationship over the next 3 years and even beyond as you progress. Also, I would like to say, just in wrapping up, that I would encourage you also, once again, to look at your FYI guide after tonight, specifically pages 35 through 37, where much of what we discussed tonight is covered as in detail, and especially look at page 37 in the to-do list. It's a recommendation of about 10 to 12 things that you should be really doing in your first semester or over your first year to get a good start as a pre-health science student at Case Western. And you'll see there again, recommendations: meet with me, meet with others.
Great. Thanks, Stephen. In addition, I just want to mention some upcoming webinars. Note that on your student checklist, if you go to the Academic Advising and Registrations tab and follow that to first year registration, underneath that tab you can click to the live webinar, which is probably how you got here tonight, but you can see there a list of our upcoming webinars. We have several. They're going to be next week, all at 7 o'clock, so tune in. Thanks.
Thank you for joining us this evening.